Imagine having suicide be a norm and having this being done in your physician's office and prescribed to you by your physician. Today, my proposal would be that the U.S. government, federal government, should not legalize physical assistance suicide nationwide. We'll be talking about some facts and how this would affect America and the U.S. Having physical assistance suicide may cause some confusion and some trust issues between their patients and their physicians, as this has been prescribed by physicians. According to legalizing physician-assisted suicide, some thoughts and concerns. Howard G. Cohen, April 15, 1993. Older people may be less fearful of death and thus less desperate to be in complete control of this process. There may be concerns that if physical assistance suicide were legalized, elders with chronic illness or terminal illness would be manipulated and convinced into doing this process by a family member, thus committing suicide. In Harlem, where physical assistance suicide has been tolerated since 1973, 3% to 15% of all deaths occur by this method. Physician assistance with dying patients has now extended from terminal patients to chronic ill patients to cancer patients and so forth, allowing this to be for any patient. There have been 8 cases of assisted suicide by doctors between 1990 and 1992, involving middle-aged to elderly women suffering from chronic illness, but not terminally illnesses, demonstrated that such thing can happen in America as well. Many people have been convinced by their family members to go to this route and by their physicians as well. But people need support from their family members and friends to continue in their challenge to complete their lifetime. This law has suggested that it is only for terminally ill patients, but this law has been prescribed by people who are depressed, mental illness, cancer patients, and so forth. This has been a problem in Oregon and Washington. According to Disability Rights Education and Defense Fund, May 29, 2018, during the first 3 years of legal assistance, suicide reports indicated that 59% of cases, patients had asked 2 or 3 more physicians for this lethal drug. People with depression can receive lethal drugs in Oregon and Washington. But if they are suffering from psychological disorders or depression, this may vary. By this meaning that in Oregon and Washington, people are just being prescribed the physical assistance suicide. But this has caused a lot of problems because this is an easy way when they could be treated with the proper care by their physicians and their doctors. According to physician assisted suicide, the problems presented by the compelling heart-wrenching cases JSTOR 1998, no doubt Mr. Piccolo's doctors are well trained to detect depression or anything else, but I think he may properly resist the legalization of physical assistance suicide on the ground that the majority of individuals who kill themselves suffer from depression, and this can be treatable with their clinical care. My solution would be to have this not be available in any other state or not be passed in the U.S. because there's always a better way to care for your patients. I have talked about various concerns and facts about the subject, Thank you very much. Okay.